Okay, so I gave a patient one of these and I'm sending her this video so that she knows how to use it. But to any other patients that have this, if you want to rewatch it, or if you just want to help your lower back and pelvis, you can get one of these at home, and it helps with mobility of the hips. We typically in office start patients on a wobble chair. It's a seat that's on a pinpoint and it can roll all around, and we'll start by rolling side to side and front to back, and then even work in circles and figure eights is the eventual goal. Front left, front right, back left, back right, front left. So going through there. And what we're trying to do is pump the disc that's in between the bones so that fluid can go back in there. It's really good for that hydration aspect. But it's also good for just hip mobility and lower back. So that's why I'm giving her this to take home, so that you can sit and do a modified version of those motions at home. So I can just roll back left, back right, front right. I have another person who is at a computer a lot, and we were just talking this morning about whenever she sits for a long period of time, whenever she's sewing, whenever she gets up, it's really stiff and takes her a minute to get going. So if I sit on this, then my back naturally makes me sit up a little bit more, which takes some pressure off, and then it's very easy to just, if I'm working on the computer, kick in a little bit of motion regularly, so it doesn't build and build and build with pressure, especially if I'm sitting here and slouched forward. So it helps keep me upright, and then naturally I can go into those motions. You just don't want to be sedentary with a lot of pressure building over time. Now, to give the specifics on how you want to use it, this is also for that patient, so here's how you're going to use this. If it's not just use at the desk sit at all the time, and I want to use it therapeutically each day, then all I'm going to do is roll left and right for 30 seconds, then back and front for 30 seconds. Notice I'm trying to keep stable here. I'm not doing this. I'm doing this. So rolling my hips left and right. My foot may be even coming up slightly if I go there, side to side. Then that front and back for 30 seconds. And then 30 seconds circles one direction. 30 seconds circle the other direction. And it feels weird and is difficult at the beginning, but a figure eight. I'm gonna go back left, back right, front right. Weirdly enough, this has been shown to be the most efficient motion whenever done in this combination to hydrate those discs. So that's how you want to use this. 30 seconds left, right, 30 seconds front and back, 30 second circle, 30 second circle, 30 second figure eight. That's how your homework.